So, hi guys, welcome to Podcast Med. So, the topic of discussion in this video is pediatric history taking. The pediatric history taking is divided into the following headings, which are demography, chief complaint, history of present illness, medical history, past history, birth history, diet history, vaccination history, family history, and socio-economic history. I know it's quite hectic to listen to all these headings that I've said just now, but let's understand and discuss in detail about each heading in this video, in this podcast. So, coming to the demography of the patient, in the demography of the patient, you should be noting down the name, age, gender. Informant the patient has come with. Informant is the reliable informer of information about the patient, who can be the patient's parents or guardians. Now, coming to the one more important point that should be noted down in the history taking in demography of the patient is his age. The pediatric age group is divided into subgroups where six subgroups where they are divided into neonates, infants, toddlers, preschool going, school going, and adolescent age groups. The neonatal age group is the age group where the children from the birth till 28 days are included. It is again divided into early neonates and late neonates, where early neonates are from the birth to 7 days, and from the 8th day till 28th day the neonate is called late neonate. Then from the age of 1 to 3 years, from the age of 28 until the completion of 1 year, the child is called an infant, and from the age of 1 to 3 years the child is called an toddler, and from 3 to 6 years he is called preschool going age group, and from 6 to 12 years he is called school going, and more than 12 years he is considered an adolescent. So pediatrics will deal with all the age groups until the age of 18, where more than 18 years of age is considered an adult. So till 18 years of age, pediatrics will apply to the people. Then coming to the chief complaint. Chief complaint of the patient should be noted down in a chronological order and the duration of the chief complaint that the patient has come with. For example, if the patient has come with cold, cough and fever, which is the most common complaint that we will be ever hearing in the pediatric or general medicine outpatient departments, and if he or she says the complaints are from 7 days, the patient is having these complaints from 7 days, cold and cough since 7 days and fever since 4 days, then you have to mention cold and cough from 7 days first, then about the fever next. Then coming to the history of present illness, you'll be explaining in detail about each symptom. And for example, if the symptom is cough, you'll be asking if it is productive or non-productive, and you'll be asking about the amount of sputum if it is productive, and all the sputum findings like color, consistency, odor, if it is blood tinged or non-blood tinged, if it is if it is associated with any breathlessness, etc. You'll be asking in detail about each symptom in the history of present illness and noting it down. And then we'll go with medical history after history of present illness, where medical history will involve all the medications that the patient is on chronically. Like it can be just before the admission into the hospital, if the patient is taking any medication, that also you should ask. And after that you will go with chronic illnesses if the patient has any, and if he's on any medications. For example, if he's having TB, epilepsy or seizures, or if he's taking any asthma medications, etc. So that is about the medical history. Then we'll go with the past history, where past history includes four headings. First is if the patient had any similar complaint in the past, where you will explain all the similar complaints that the patient had and in detail about them. Then coming to the comorbidities, the second thing in past history is the comorbidities. Comorbidities are the other illnesses, other chronic illnesses that the patient had from a long time. Comorbidities can be TB, asthma, epilepsy, syphilis, etc., where childhood group are not more prone to diabetes and hypertension. We exclude mentioning them here, but there are some cases where those conditions can be present in the pediatric age groups, like diabetes mellitus type 1, hypertension, juvenile hypertension, something like that. Due to any genetic disorders. Then coming to the next thing in past history, it is any history of surgeries. If the patient has underwent any history of surgeries, you should mention those as well here. And then coming to the next thing, you have to mention about allergy history of the patient. If he has any allergies towards anything, and if he had any allergy like symptoms after getting exposed to some allergen, like it can be dust, it can be scents and perfumes, it can be any other smells, etc. And you can also ask about any medicational allergies, like if he is allergic to any medications, if he has developed any symptoms when he got exposed to that medicine. Then the next thing that we are going to discuss is his birth history. His birth history means we'll be asking about how he's born, cesarean section or normal vaginal delivery, and we'll be asking about his birth weight when he is born, and also we'll be asking about if there are any complications that he had or his mother had faced during the delivery, and then after the delivery, the condition of the baby, how if he had any asphyxia or hypoxic conditions, if he had any what do we call respiratory distress after being born, etc., because it can affect his overall development in the future. As for example, if he had any hypoxic episodes, then the baby might face a condition called hypoxic encephalopathy, where for a period of time, if the brain doesn't receive the blood during the birth, then it might cause enormous amounts of developmental defects in the baby. So that's what we'll ask about. Then after the birth history, we're going to ask about developmental history, which can also be included under birth history, where we'll be dividing the domains of development into four, which are gross motor, fine motor, social, and language. Where gross motor or the motor movements the baby is doing, like walking, running, sitting, etc. Where fine motor or the movements that the baby is doing with his hands, where fine movements like writing, holding a pencil, holding an object, pincer grasps, etc. Then social domain is the social attitude of the baby towards the outside world, where the baby cry. He will cry obviously in the first, just after birth, but I'm saying about a smiling, playing peekaboo, etc. Then we'll go with the language milestones. We can say monosyllabic speech, jargon speech, bisyllabic speech, the baby saying words, sentences, etc. That is our language domain of development. Then after these domains of development, we're going to mention about all this development, if or normal or abnormal. If abnormal, what are they? Then after birth history and developmental history, we'll go with diet history, where in diet history you are going to calculate the total calorie intake of the baby or the child just before getting admitted in the hospital. Generally, what are the meals that he will be eating during the day, approximately, and will calculate calories for each item in which quantity it is consumed and how many calories it costs. So the total day calories that the baby or child is consuming, will be calculating it. Then will be checking his calorie requirement, how many calories does he actually need. That can be known by this method. So for 0 to 10 kg, you will be calculating calorie requirement like 100 kilocalorie per kg per day. So if he is a 10 kg baby, so then he'll need 100 into 10, totally 1000 kilocalorie per kg. Sorry, 1000 kilocalorie according to his weight. Then from 10 to 20 kg baby, so you'll be adding 1000 kilocalorie of the 0 to 10 kg plus 50 kilocalorie per kg for each kg above 10 kg. And then if the baby or the boy is about 20 kg, then it is 1500 kilocalories plus 20 kilocalorie per kg for each kg above 10 kg. About 20 kg, sorry. So this is the method in which you will calculate the calorie requirement. We can also calculate the fluid requirement as well by the same method, where kilocalories will be replaced by ml of water. Just the same, 0 to 10 kg a boy needs, boy or girl. I'm in this video mentioning more of he, but that doesn't mean it can be only he, it can be she as well. So 0 to 10 kg, he needs 100 ml per kg per day. So like this, we can even calculate fluid requirement. And about the details of formulas, methods of calculation, and few other points, I'll be tagging the details in the description. So please check it out. And after this calorie requirement and fluid requirement in diet history, we'll be calculating calorie deficit, where calorie deficit is the calorie requirement that the baby has or the child has minus the total calories that he is taking actually. And that is all about his diet history. If he has any calorie deficit in his diet history, then we have to advise the parents and suggest the parents a diet chart that they should follow, and to make the baby well nourished. If he is being malnourished, it is a very good predisposing factor for infections. So we'll be warning about it to the parents. Then after diet history, we'll be asking about the vaccination history, where vaccination history involves all the vaccines that the baby took till date. So if he is immunized completely till date or not, we'll be checking. Then after immunization history, we'll be asking about family history, where family history involves any similar complaints in the family, because his parents also can infect him because they live together in the same house. Then after this, we'll be asking about any comorbidities run in the family, like TB, asthma, because it can be familially transferred to the child. Then after that, we'll be recording a pedigree chart of the family, where you'll be mentioning about his parents, if any one of the parent is deceased, if the parents marriage is consanguineous or not, where consanguinity is the marriage of a couple who are of very nearest relation. Okay, there are 3 degrees of consanguinity, where first degree of consanguinity is the marriage of his parents who are very near relatives, and Second degree is when the parents of his parents are also related through blood in the family. And third degree is when the third generation, like the grandparents parents, the baby's grandparents parents, or also three generations or of consanguinity is seen. That is third degree consanguinity. Then after family history, we're going to ask about socioeconomic status of the family. But socioeconomic history of the family involve considering the family under some classes. One of the 5 classes which can be classified according to the modified Kuppaswamy scale. Modified Kuppaswamy scale considers 3 factors into consideration, where they are education, income, occupation. According to the education of the head of family, it is divided into eight what is this called, eight classes education. For example, education is divided into professional, postgraduate or graduate, intermediate, high school, middle school, primary, illiterate, etc. According to this, they will be numbered differently. And according to income, there are 7 classes again, and according to occupation there are 7 classes again. Each class will have a number, so we'll add up all the numbers that we get at last, and the number which results in the last will decide the class of the family. So if the number is under 5, less than 5, it is the lower class family. If the number is between 5 to 10, the family is upper lower family. And if it is between 11 to 15, it is lower middle family. And if it is between 16 to 25, it is upper middle family. And if it is 26 to 29, it is upper class family. So like that, according to Kuppaswamy scale, we do the classification of family. And then in socio-economic history of the family, we'll also ask about the type of house they live in. If it is a kacha house or pakka house, if it has if the kitchen is separated or inside, if they maintain toilet and sanitation properly, and if there is any smoke vent, if the lightning and ventilation are proper. And the most important thing next is the overcrowding, if there is any overcrowding in the family or not. So after this, the history taking of the pediatric age group is completed. So any other details, if needed, I'll be tagging it in the description. Please check it out. And after this, we'll go for general physical examination in the next video. Before that, I'll explain all the symptoms in details in the history of present illness, that as I have already said in the video. So like that, the pediatric history taking is done.